Good morning, Ms. Smith.
Good morning.
So, as far as I understand, you are here for a follow-up appointment after Matthew's recent.
Yes, he's much better now, but I had a very little understanding. Like this was completely unexpected, and see, he's so young, and I really wanted to know what exactly was the cause of the problem.
Sure. As a parent, it is natural to have such concerns, particularly when he's just 5 years old. So, how much do you know about asthma? Have you?
I think somebody. I was really upset that day, and I was told about the condition, but because of my the mood that day, I was not able to concentrate. So, would you mind sharing me the information?
No, that's not a problem. Okay, so asthma, basically it is allergic. It is allergy of the airways, the windpipe and the lungs, the tubes in the lungs. So what happens is some children, they have a very very sensitive immune system. And because of that, when they come into contact with some things like dust or pollen or excessive smoke, their airways, they become swollen, inflamed.
I see.
I know this is difficult to understand, but I hope you're following.
Yes.
Okay. So as a result of this, swelling and the narrowing of the airway, the air cannot pass smoothly in and out. And that is why the common symptoms these children get would include difficulty in breathing, and the wheezing sound because the air cannot pass in and out. So these are the common symptoms that children can have because of asthma.
Oh, so exactly, if I ask you, what is he allergic to? Because how do I know if he gets an attack actually?
That's a very good question. Now, different people are allergic to different things. So at this stage, we can't say for sure exactly what is causing allergy for him. But the common allergen, include fur of the pets, the pollens of the flower, smoke if somebody smokes in the house, dust or some pollutants. So as a parent now, you will have to keep an eye on him and see what is causing allergy for him and make a note of it. Can you do that?
I think I can start noting them down in a diary.
Yes. So these were the symptoms that he was having were mild symptoms, but as a parent you should be aware that it can sometimes become severe. So if somebody gets a severe attack of asthma, they can develop more serious symptoms, like it can lead to bluish discoloration of their fingers or of their lips, and this would mean that he's not getting enough oxygen supply, or they might feel dizzy or not fully oriented. So these can happen if the patient does not receive treatment on time.
That sounds frightening, but how do I handle this?
Okay, so there's no need to be concerned about it as yet, since the attack he had was mild. But I just want to ensure that you are aware of what kind of serious consequences can happen, and of course you should know how to deal with that.
Sure.
Okay. So about the treatment, there are mainly 3 things I want you to recommend. These are the 3 very important things you should take care of. First of all, as I said, noticing which things are causing this allergy for him, triggering the asthma, and making sure that he does not come into contact with any of these.
Okay.
How difficult do you think this would be, like keeping him away from the allergens?
I think I can manage that. Yeah.
Okay, that's good. Okay, the second thing, like as you said, how to handle if he gets an attack, right? So if it is a mild attack like it was last time, you can go ahead with the blue inhaler. I'll be asking the nurse to give you more advice on how to use that inhaler.
That must be helpful.
Yeah. So you should be giving that inhaler immediately to him. Wait for 20 minutes, and in most cases the symptoms should resolve after 20 minutes.
Okay.
And if the symptoms don't resolve after 20 minutes, okay, you can give another dose
Okay.
and see how he's doing.
Mm-hmm. Anyways, you sound so scaring. Could you please tell me, is he going to be okay?
Definitely. See, most children with asthma recover, provided that the parents are aware and they take proper precautions. So if you give treatment on time, he's not going to suffer from any complications. And if he does, like in spite of giving the inhaler, as I said, if his symptoms don't resolve, then don't wait any further. If you notice any of the danger signs, like as I said, bluish discoloration of his lips or nails, or if you notice that he's not fully conscious or aware, then rush immediately to the hospital. This is not to scare you again, Ms. Smith, but this is just to ensure that you are alert and you are taking steps on time.
Okay.
I hope you're following.
Yeah, but what if after following all the precaution, he still finds it difficult to breathe?
Then you should immediately rush to the emergency department.
Okay.
Yeah, that's the time that we shouldn't wait any longer and we should seek immediate medical help.
Sure.
Yeah.
Okay.
Okay. And finally, because he's young, just 5, he's likely to attend school. He might be, attending daycare center. So the third thing I wanted to ensure is that everyone around him is aware of his condition. You should inform the staff at school, and they should also know how to handle if he gets attacked at school. Okay.
Sure.
So can you discuss these things with?
Yeah, at least I can put an effort that I should be going and making them aware of his condition and help them understand. Once, as you just told me that the inhaler, somebody shall be explaining me how to use them also. Maybe I can also display the same thing to them, and that should help Matthew.
Yes, very much. Are there any other concerns that you would like to discuss?
No, I truly appreciate that, doctor.
Okay. And about his prognosis, as you said, you are worried whether he would be able to overcome this or not. So rest assured, most children, who develop this asthma in their childhood are able to overcome. They are able to grow out of it by the time they enter in the teenage, and very few of them may continue to have it in adulthood as well. So the chances are there that by the time he enters teenage, he'll be able to completely overcome this condition.
Okay, so that sounds pretty, quite helpful. And I think if we manage the way you just explained, I'm sure he might come out of it.
Okay, and can you just summarize for me the measures that we have discussed so that I can make sure that you have understood them correctly?
Yeah, I should be started noting down the trigger factors, and I should be making sure that he's away from any allergens. Especially, I should be more aware how to help him use the inhaler.
Yes.
And any sign of that where my child is not able to breathe properly, I should be immediately rushing him to the hospital.
Yes.
And I'll also make sure that all the connected people to him, that is at the school or at the daycare, they should be also able to handle him if something goes wrong.
Yes.
Yeah.
Okay. So does this help you to be a little bit more assured?
That gives me a lot of relief, and I hope both of us, I think, can manage.
Okay, and the final thing I would like to do here is I'll be developing an asthma action plan for him, which means the steps that he should be taking if in case he gets an attack.
Sure, that will be very handy. Thank you so much for that.
And then we'll be arranging appointment after 15 days to see how he's doing after starting on the inhaler.
Sure, doctor.
Yeah.
Thank you.
Okay.